Hey guys, it's Hannah again, and today I'm going to be talking to you guys about preparing for clinicals, preparing for your first semester and first year of the nursing program. Also, how to prepare for clinicals is what I'm going to talk to you guys about, give you guys some advice, some tips, get you guys started, kind of get your mind in the mindset of nursing program and what you need, just kind of give you guys an idea of how to get yourself prepared. Like, comment, and subscribe to my channel, please. Follow me on Instagram and tune into my next video, which will be MedCalc. I'm going to show you guys a couple of MedCalc questions that can kind of resemble your quiz that you will have to take in first semester. I mean, you're going to have to take a quiz every semester. But for your first semester, you're gonna have to take a MedCalc quiz. And in my semester, we had to get 100% and we had 3 tries. So I'm gonna go over some MedCalc questions for the next video. So tune into that. Before you start the first semester, get your work schedule squared away. Talk to your supervisor. Like, once you find out your school schedule, talk to your supervisor and kind of get your work schedule together. Well, I know that I wasn't able to work. I'm not able to work in nursing school. Like, since I started the program, I have not been working while in school. I work in the summer. So you guys want to make sure you talk to your supervisor and let them know when you can work and when you can't work. Very important. Get your work schedule together because you're going to need time to study. You're going to need time for school and your classes. You're going to need time for your clinicals. So get all that together before school starts. Schedule all your appointments. Schedule everything that you need to do. Schedule it before school starts. And when you guys are able to see your classes on Blackboard, make sure you look at the syllabus, get an idea of everything you need to do. Look at all your assignments. Buy a planner. That's another thing. Buy a planner. You want to buy a planner. I cannot stress that enough. Planners have been good to me and been good to a lot of the students that I know in my program. Look at all your assignments, all your projects, all your papers, all the important dates, put it in your planner. Look at your planner every day and make sure that you have done everything the planner states. Like, make sure you do everything that's on your planner day by day. Look at your planner every day. So it's a good way to get an overview of everything that you'll be doing in the semester. So just organize yourself. Very important, be organized. This is not the time to be a last minute person or be unorganized. Like, you have to be organized in the program. So you also need to, I know that there's a lot of people who are last minute and it works for them, but be ahead of the game. Work ahead. What else? Let's see. What works for other people may not work for you. Practice MedCalc questions. Go over your anatomy if you can. So I'm going to give you guys advice on how to prepare for clinicals. And I know my first semester, we had clinicals in the nursing home. And it was only 4 days. Only 4 days of clinicals. This is just like a general list of things you're going to need for clinicals to feel prepared, to be prepared. You want to get your uniform, obviously. You want to get comfortable shoes. You also want to get shoes you can clean and wipe off easily, because the hospital and nursing home, you don't want to bring in any germs. So when you bring your shoes inside, clean your shoes at the door, wipe it down, and you want to just keep it at the door. So getting comfortable shoes and getting shoes that can be cleaned and wiped down easily. Don't get the cloth shoes. Yeah, just get shoes that you can clean easily. You need a stethoscope. So I can show you guys my stethoscope. And I got the Littman, I forgot the name. I think it's Littman Classic or whatever. I think it was like $40 something or $50 something. I don't remember. But get a good enough stethoscope, at least for nursing school. And then after nursing school, you can think about getting the very expensive cardiac one, the cardiac stethoscope or whatever, but get a good enough one that works well for the program, at least. This is pretty good. I got it last semester. Like I said, I'm going into my last semester of nursing school, so I got this my third semester, the previous semester that just passed. And it works pretty good. Like, I'm able to hear respirations and listen and hear the heart rate and all that. You also want to make sure you have a notepad. Get a notepad so you can take notes and write things in clinical that you may not understand. So let's say there's something that the nurse mentions that you're confused about, you can write it down, look it up later. So that way when you hear that thing again, you'll know what it is. It's a good way to learn while you're in clinical, so where you can write important things down. Get a notepad, make sure you bring a pen because I tend to forget my pens. Bring a pen to clinicals. You can also buy cheat cards from Amazon. So along with buying cheat cards, get a badge. You need a badge so you can like wear it on your uniform. It can hold your school ID. What else can it hold? Cheat sheets, things like that. I have a cheat sheet on here that one of our nursing students made. Don't know if you guys can see it, but it has like the normal vital signs, the normal blood pressures and the abnormal blood pressures, things like that. Very helpful for when you forget things on the unit or during clinicals. You also need a clipboard. The clipboard I got was from Amazon. It has some cheat sheet stuff on it, some helpful things on it. I think I put it upside down. Like injection sites, checking your pupil size, but you guys will learn about that during school, but I'm just showing you guys that there's some helpful things on this clipboard. Also, to prepare for clinicals and even lecture, get snacks, like pack a lot of snacks to give you energy for the day, to keep you focused and alert for the day. Even in lecture, in my program, our lecture lasts for like 3 hours. So you can only imagine for someone like me who gets hungry fast, I need snacks on deck. That's like the gist of what you need for clinicals. So get your stethoscope, get your pen, your notepad, your uniform, comfortable shoes that you can clean easily, clipboard. Just to mention, the classes I did take first semester, I took fundamentals of nursing in the context of the older adult, and that came with clinicals. So my clinicals was in the nursing home. I also had health assessment. I took research and evidence-based practice course, professional role of the nurse, and I took physio pharm, health promotion. But to get into the books you're going to need, so definitely for clinicals, you're going to need your drug book. I have the Mosby's 2017 drug book. You're gonna need it. The nurses are gonna be mentioning a lot of medications and you're gonna be like, what is that? What is it for? What does it do? Just bring your drug book. I do know that drug information is on the computer, but I don't think my first semester, we didn't have access. No, we did have access to the computer, but yeah. Either way, just have this on deck. Your drug book, very important. You also want to have your physical examination and health assessment book. This is not the book. So this is not the big book. This is the pocket book. The pocket book is very convenient and it's like a short version of the actual textbook. And it's very helpful for when you're doing your physical assessments, your head to toe assessments on your patients, which you guys will learn about when the semester starts. But yeah, I'm just giving you guys a little idea. The big regular physical assessment book. For the fundamentals of nursing in the context of the older adult, these are one of the books you need. So you should get this, definitely. Don't want to waste unnecessary money. So I'm telling you guys, the most important books, in my opinion, the most helpful and used books, in my opinion. You're gonna need this book for all of your semesters in the program. Let me see if I can get it focused. It's the Nurse Pocket Guidebook. So your diagnosis, so this has all the diagnoses inside. But you're gonna use this for your care plans because you have to make diagnoses on your patients. So this book, you definitely need it. You guys should hold off on books for like the research class. What book was that? Like there's some books that you should hold off. So like the research and evidence-based class, I didn't really need the book. I wasted my money on it. Book for the professional role of nursing, I don't really think I needed that book either. I don't think it was worth buying. But I will say the fundamentals book. The fundamentals of nursing in the context of the older adult book, the textbook, you need it. Some of these books you can actually use for your care plans when you guys talk about care plans in the future, but don't worry about that right now. But you're going to be doing care plans, and your textbooks can come in handy because it can have important information about certain disease processes that your patients may have. All the other textbooks, just hold off until you feel like, okay, yeah, I need this book. Always remember to do self-care. Take breaks because the semester, it is a lot. Even if full-time, part-time, either way, it's a lot. You're gonna have times where you wanna cry. You're gonna have times where you wanna cry. You're gonna have times when you feel like giving up. You're gonna have times when you feel like, oh my gosh, like why did I choose this major? Take some breaks, breathe, like I always say. Go hang out with your friends if you can. Like I know that I didn't really have that much free time, but try to hang out with your friends, talk to your family members, even if it's for an hour. Go get ice cream, even if it's for an hour. Do something other than nursing, school. Do something other than school when you start feeling stressed and overwhelmed. Just to take a break, like take breaks. Sit in your car and meditate, listen to music, whatever you do that helps you de-stress, do it, okay? Because the program is a lot. Self-care, take care of yourself, drink your water, eat, don't starve yourself during the program because you feel like you're so busy. Take care of yourself. That's my advice to you. So I told you guys how to prepare for first semester or the first year of school, how to prepare for clinicals, and I gave you guys book advice on books that I felt were very useful and was not a waste of money because I know I'm gonna be using it even in my last semester. So yeah, I hope you guys found my video helpful. Like I said, tune into my next video on MedCalc. I'm explaining MedCalc in the easiest way possible. Like, comment, subscribe to my channel. Bye guys, see you in my next video.